welcome to Stony Brook University's Community of Scholars webcast. My name is Aradhana Natarajan, and we're here today with student Elizabeth Jerumko, who you met last week, and Dr. Dina Vivian. And this is the final part of our bit about mental health on college campuses. Doctor, would you like to introduce yourself?
Sure. I'm a clinical professor in the Department of Psychology, and I'm also the director of the Leonard Krasner Psychological Center, which we call KPC. And I'm the training director for our pre-doctoral, internship, and postdoctoral fellowship programs at Stony Brook. The clinic is a clinic open to the community, inside the campus and outside the campus. And we see people of all ages. We see over 200 people a year. We screen over 400. And the majority of the people that we see are Stony Brook students.
Okay, so when you see Stony Brook students, what kinds of issues or concerns do they typically present with?
We first of all, let me say we have some specialty clinics, and so we have a lot of referrals from CAPS that refers students to us for specialized cognitive behavioral treatments for specific kind of problems. So we have, for example, an anxiety disorders Center for Excellence in the treatment of CBT-based anxiety disorders. We also have a specialized clinic for depressive disorders. We treat ADHD. We treat problems related to different kind of stressors, life stressors, and specifically for the students that we see on campus, the majority are undergrads, but we also have a lot of graduate students that seek services at our center. And the majority of the problems that we see, because of the specialty clinics that we have, are related to anxiety disorders and depression. But usually anxiety disorders and depression kind of go together a lot. So we usually have a lot of comorbidities between those two types of problems. In terms of the anxiety disorders that we see a lot of generalized anxiety, we see PTSD, we see OCD, and we see a lot of social anxiety and a lot of academic anxiety. And many times you see multiple anxieties at the same time. And interestingly, very few people know that social anxiety is a big problem among students. And it is really, truly a crippling problem because it prevents students from going to classes, from going out of their dorms, from going to eat at SAC. And so it's a very difficult problem that augments every other stressor that students go through. And especially with undergraduates, a lot of the stressors are being able to adjust to living independently away from home and being able to sustain a program of studies that is generally much more challenging than the one that they're used to from high school. And so the transitioning to college is a very potentially stressful and potentially very crippling time of life. So we see a lot of that reflected in anxiety and comorbidity with depression. So many times we see depression going hand in hand with anxiety. And the depression many times is related to not being able to do well in school, being isolated, not being able to find friendships. Sometimes we see a lot of problems specific to identities, like diversity-related identities, cultural identities. We see a lot of international students at the KPC, and with each additional stressor, you see additional difficulties and problems. And so we deal with all of that. To make these services more accessible to students, we actually have a different. Our clinic is a fee-for-service clinic. We don't really bill insurances, but for students we have reduced fees. So the students usually charge $20 per session, and for the groups that we offer groups on social anxiety, on academic anxiety, on problems related to ADHD, which is another big problem that we see. We offer that 3 times a year. And so the fees for those are even lower. They're only $10 per session for 10 sessions we have. And so we offer all of that as a way of reaching out to students to make these services available to them so that they actually can benefit from the resources that we have on campus. Differently from CAPS, we do not have a time limit on the amount of sessions, and we actually do very specialized sort of trainings and treatments, like I said, for ADHD and the anxiety problems. So people sometimes benefit from going to CAPS and then coming to us. CAPS refers students that they feel could benefit from a longer-term treatment or treatment for specific problems like the ones that I described. As a student yourself, not knowing maybe about what psychological services entail, I don't know if you were a consumer or not, and I don't need to know, but you may have some questions from a student's perspective.
Okay, yeah. So last week we spoke about student experience with trauma, and I was wondering, how long does it typically take students who experience trauma or who are experiencing the onset of a mental illness to seek help?
That's a very broad question. And I don't think that is really a question that pertains only to students. You're asking right now a general mental health question. So let me address it in that way. Most of the disorders that we encounter in outpatient clinics are disorders that start early on, typically the onset in adolescence or even earlier on. And the emerging adulthood phase of a person's development is particularly critical for the onset of problems. And so we have like the combination of many different factors that sometimes may co-occur to create a higher base rate of psychological problems in college students than, for example, in the general population. So it's the age, it's the phase of life, it's the stressors that they're encountering. So that's in terms of addressing your onset issue. In other words, very rarely do we see somebody with psychological problems whose problems started when they were 40 or 50. There are problems related to every phase of life, but typically there is a very early onset. And then there's a waxing and waning through life. The type of theories right now that are best supported are psychobiosocial theories of mental disorders in a sort of a diathesis stress, where there is a propensity to have a psychological, clinically severe disorder. There is a propensity, and then there are stressors that trigger the actual experience of the symptoms. Have I addressed your question?
I'm going to turn
you were talking about trauma.
Yeah.
Okay, so tell me specifically what you want to know about trauma, though. It was very open-ended, the question.
So I guess in a way I'm asking, is it ever too late for someone to seek treatment? Because a lot of college students might feel that there's personal or community barriers to seeking help, and after a couple of years have passed, they might feel hesitant towards approaching someone for healthcare.
Never too late. Never. One should be, unfortunately, people sometimes lack the information about what psychological resources can do for them. And by psychological, I actually will say more broadly psychiatric, because we shouldn't be thinking in terms of psychosocial interventions like psychotherapy as being the only kind of treatment. Many times psychotherapy plus medication, actually, which we call combination treatment, they actually boost and increase the response to treatment. So it's never, ever too late to start. The earlier the better, obviously. And so individuals whose families are savvy about the resources of mental health are lucky. Whose families are supportive are lucky. Whose families foster their access to these resources are lucky, because many times have had that early positive access. And so then if later on, should they be in a need for more treatment, then they get more treatment. And that is kind of the model, is to have treatment when needed for a relatively limited amount of time, then try the new skills, the new coping strategies that people learn, try that out. If something comes up again, then they can go for treatment again. And treatment should be from the cradle to the grave, in the sense of whenever is needed. Now, at different stages of treatment, you learn different things. So initially, you may learn the skills. For example, the main things we do in cognitive behavior therapy, which is the main kind of model that we provide at the KPC, which is the evidence-based sort of approach to treatment. We look at the here and now of the problem. We look at what are the most important impacts of the problem on the person's life. And we really work with the person to teach them, and I'll use the pronoun them, to teach them how to really cope better. So we're looking at cognitive patterns, behavioral patterns, and emotional patterns that are related to the problem, and we address each and every one of those domains. So we look at ways in which people think that are not most adaptive. We look at ways, for example, thinking in a very globally negative way, over-predicting the probability that something bad's going to happen, underestimating your ability to cope with that. So those are all patterns of behaviors that are associated with both anxiety and depression. So we really teach people to recognize the maladaptive thoughts that are affecting their emotional functioning. There are some emotional problems that we deal with, like difficulty tolerating emotional distress, regulating emotional distress, inability to stay in the moment, and so we deal with that in terms of really like elements of dialectical behavior therapy. And then for the behavioral end, we really look at ways in which people act that also are contributing to their problem. So avoiding, for example, feared situations, avoiding going to class, avoiding going to test, avoiding getting up out of the bed, avoiding meeting with friends, isolating oneself. So avoidance is a major, major behavioral pattern associated with psychopathology because it does compound the effect of negative cognitions, and it also deprives people from the possibility of experiencing something positive. So, and being completely deactivated.
And when we come back, we'll be talking about services that Stony Brook University offers.